Have you ever felt like your digestive system just isn't working the way it should? Maybe you've been struggling with constant bloating, unexplained fatigue, stomach discomfort, or irregular bowel movements. You've tried probiotics, cut out certain foods, even experimented with trendy gut cleanses, but nothing seems to make a lasting difference. It's easy to wonder whether something deeper is going on. One question that comes up frequently is whether intestinal parasites could be playing a role. Today, we're going to separate facts from myths. We'll explore what intestinal parasites really are, who is actually at risk, the symptoms that deserve attention, and most importantly, the science-backed ways to support your gut's natural defenses. We'll also discuss foods that promote a healthier intestinal environment, habits that strengthen your immune system, and when natural strategies simply aren't enough. The goal isn't to scare you. In reality, most digestive symptoms are caused by much more common issues like irritable bowel syndrome, food intolerances, bacterial imbalances, or chronic stress. But in some cases, parasites can be part of the picture, especially after international travel, contaminated food or water exposure, or close contact with infected individuals. Understanding the difference could save you months or even years of frustration. Your digestive tract is home to trillions of microorganisms working together to digest food, produce vitamins, regulate inflammation, and support your immune system. Nearly 70% of your immune cells are located in and around your intestines. When this ecosystem is balanced, your body is remarkably good at protecting itself. But when that balance is disrupted, unwanted organisms may have an easier time taking hold. That doesn't mean every digestive problem is caused by parasites. Unfortunately, social media has popularized the idea that almost everyone is secretly infected and simply needs a special detox or herbal cleanse. Scientific research tells a very different story. True intestinal parasite infections are diagnosed through laboratory testing, medical evaluation, and sometimes specialized stool analysis, not by internet quizzes or dramatic detox symptoms. That's why today's discussion focuses on supporting your body's natural defenses, rather than promising miracle cures. By the end of this video, you'll understand 7 practical strategies that help create a healthier gut environment, improve digestion, strengthen immunity, and reduce your risk of intestinal infections naturally. Let's begin with understanding exactly what intestinal parasites are. Parasites are organisms that live on or inside another organism, called the host, obtaining nutrients at the host's expense. In the human digestive tract, the 2 major categories are protozoa and helminths. Protozoa are microscopic single-celled organisms such as Giardia, Cryptosporidium, and Entamoeba histolytica. These are commonly spread through contaminated water or food and can cause diarrhea, abdominal cramps, nausea, and dehydration. Helminths, on the other hand, are worms including roundworms, hookworms, whipworms, and tapeworms. Depending on the species, they may live in the intestines for months or even years if left untreated. The important thing to understand is that these infections are not randomly appearing inside healthy people. They are usually acquired through specific exposures, drinking contaminated water, eating undercooked meat or fish, consuming unwashed produce, walking barefoot on contaminated soil in certain regions, or poor sanitation practices. This is why travel history and environmental exposure are often important clues for healthcare professionals. So how might someone know if a parasite is actually present? Symptoms can vary dramatically. Some people have no symptoms at all. Others develop persistent diarrhea lasting several days or weeks. Some experience abdominal pain, bloating, excessive gas, nausea, unexplained weight loss, poor appetite, or nutritional deficiencies because certain parasites interfere with nutrient absorption. Fatigue is also common, but here's the important point. Fatigue by itself is incredibly nonspecific. Poor sleep, stress, anemia, thyroid disorders, depression, vitamin deficiencies, uncontrolled diabetes, and countless other conditions can produce exactly the same symptom. That's why self-diagnosis is rarely reliable. If symptoms persist, appropriate medical testing is far more valuable than trying random supplements. Now here's something fascinating. Your body already has multiple defense systems designed to prevent parasites from settling in the first place. The first line of defense is stomach acid. Healthy stomach acid destroys many harmful organisms before they ever reach the intestines. The second defense is digestive enzymes and bile, which help break down food while making the environment less hospitable to many pathogens. The third defense is the intestinal microbiome. Trillions of beneficial bacteria compete for nutrients and attachment sites along the intestinal wall, making it more difficult for harmful organisms to establish themselves. Finally, your immune system constantly patrols the digestive tract, identifying and eliminating invading organisms before they can multiply. Rather than trying to flush parasites out overnight, supporting these natural defense systems is a much more realistic and scientifically grounded approach. The first strategy is to nourish your microbiome with fiber-rich foods. Beneficial bacteria thrive on dietary fiber found in vegetables, legumes, fruits, oats, flax seeds, chia seeds, and whole grains. When these bacteria ferment fiber, they produce short-chain fatty acids like butyrate, which nourish the cells lining your colon and help maintain a strong intestinal barrier. A healthy intestinal barrier reduces inflammation and supports normal immune function. Many people fall far short of the recommended daily fiber intake, and this alone can negatively affect gut health over time. Start increasing fiber gradually while drinking enough water to minimize digestive discomfort. The second strategy is to include fermented foods if you tolerate them well. Foods such as plain yogurt with live cultures, kefir, sauerkraut, kimchi, and fermented vegetables introduce beneficial microorganisms that may support microbial diversity. These foods aren't parasite treatments, but they can contribute to a healthier gut ecosystem that supports overall digestive resilience. Avoid highly sweetened versions, since excess sugar may encourage less favorable microbial changes. The third strategy focuses on colorful plant foods rich in polyphenols. Blueberries, pomegranates, green tea, cocoa, herbs, and many colorful vegetables provide compounds that beneficial bacteria transform into bioactive molecules with anti-inflammatory effects. These foods help nourish both your microbiome and your immune system simultaneously. Think of them as fertilizer for the beneficial organisms already living inside you. The fourth strategy is one many people overlook: adequate protein. Your immune system depends on amino acids to build antibodies, enzymes, and immune cells. Without enough high-quality protein, your body's ability to respond to infections may be compromised. Aim for balanced meals that include lean poultry, fish, eggs, beans, lentils, tofu, or Greek yogurt, depending on your dietary preferences. The fifth strategy is proper hydration. Water supports digestion, bowel regularity, nutrient transport, and the protective mucus layer lining your intestines. Constipation allows waste to remain in the colon longer, potentially worsening digestive discomfort, although hydration itself does not wash out parasites. Think of hydration as maintaining the healthy environment your digestive system needs to function optimally.
Now let's talk about some of the natural foods that often come up in conversations about intestinal parasites. This is where it's especially important to separate traditional practices from what modern research has actually confirmed. One of the most frequently mentioned foods is garlic. Garlic has been used medicinally for thousands of years across many cultures. When a garlic clove is crushed or chopped, it produces a sulfur-containing compound called allicin. Laboratory studies have shown that allicin has antimicrobial activity against certain bacteria, fungi, and some parasites in test tubes. That's interesting science, but here's the important distinction. What happens in a laboratory dish doesn't always translate to the human body. The amount of allicin that reaches your intestines after digestion is much lower than what's used in many laboratory experiments. So while adding fresh garlic to your meals can absolutely be part of a healthy diet, it's not considered a proven treatment for intestinal parasite infections. The same applies to many herbal supplements marketed online. Another food you'll hear about is pumpkin seeds. Pumpkin seeds contain healthy fats, magnesium, zinc, protein, and plant compounds that have been investigated for their effects on certain parasites in animals and laboratory settings. Some traditional medicine systems have used pumpkin seeds for centuries. But clinical evidence in humans remains limited. That doesn't mean pumpkin seeds aren't worth eating. Far from it. They're one of the healthiest snacks you can include in your diet. They support heart health, help maintain healthy blood sugar levels, provide important minerals for immune function, and contribute fiber that benefits your gut microbiome. Instead of thinking of pumpkin seeds as a parasite cleanse, Think of them as one piece of a diet that strengthens your body's natural defenses. Papaya seeds are another popular recommendation on social media. Several small studies have suggested they may contain compounds with activity against certain intestinal organisms. However, the research is still preliminary, and there isn't enough evidence to recommend papaya seeds as a reliable or standardized treatment. Large amounts may also cause digestive upset in some people. If you enjoy fresh papaya as part of a balanced diet, that's perfectly reasonable. It's rich in vitamin C, antioxidants, and digestive enzymes that may support normal digestion. Next, let's discuss one of the biggest factors affecting your gut's ability to defend itself, your microbiome. Imagine your intestines as a densely populated city. When beneficial bacteria occupy the available space, consume nutrients, and communicate with your immune system, harmful organisms have a much harder time finding room to settle in. Scientists call this phenomenon colonization resistance. It's one of the reasons maintaining microbial diversity is so important. Unfortunately, several common habits can reduce that diversity over time. Highly processed diets low in fiber. Excessive added sugars. Chronic stress. Poor sleep. And unnecessary use of antibiotics. Antibiotics save lives when they're truly needed, but they also reduce populations of beneficial bacteria. This doesn't mean you should avoid antibiotics prescribed by your healthcare provider. It simply means they should be used appropriately, not for every minor viral illness where they provide no benefit. If you've recently completed an antibiotic course, rebuilding your microbiome through a fiber-rich diet, fermented foods if tolerated, and overall healthy eating becomes even more valuable. Now let's talk about something many people underestimate: sleep. Most people think of sleep as something that affects energy levels. But during sleep, your immune system becomes remarkably active. Research shows that inadequate sleep can reduce immune cell function, impair communication between immune cells, and increase chronic inflammation. Adults who consistently sleep fewer than 7 hours per night often experience reduced immune resilience compared with those getting 7 to 9 hours of quality sleep. That means improving your sleep isn't just about feeling rested. It's an investment in your digestive health, immune function, and overall recovery. Aim for a consistent bedtime, reduce bright screens before sleep, and keep your bedroom cool, dark, and quiet whenever possible. Now let's discuss stress. Your brain and your gut are constantly communicating through what's known as the gut-brain axis. When stress becomes chronic, your body releases higher amounts of cortisol and other stress hormones. These hormones can influence gut motility, increase intestinal sensitivity, alter microbial balance, and even affect the integrity of the intestinal barrier. This helps explain why stressful periods often coincide with bloating, stomach discomfort, or changes in bowel habits. Managing stress doesn't require hours of meditation every day. Even simple practices like daily walking, deep breathing, spending time outdoors, connecting with friends, or engaging in hobbies can reduce stress levels and support healthier digestion. Exercise deserves special attention as well. Moderate physical activity improves circulation, supports immune function, enhances bowel regularity, and has even been associated with greater microbial diversity. You don't need intense workouts. A brisk 30-minute walk most days of the week provides meaningful health benefits. Strength training 2 or 3 times weekly can further improve metabolic health, which indirectly supports immune resilience. Now let's shift our focus to prevention. Preventing intestinal infections is far easier than treating them. One of the simplest habits is proper hand washing. Soap and running water remain among the most effective tools for reducing transmission of many infectious organisms. Wash your hands before preparing food, before eating, after using the restroom, after changing diapers, and after handling animals. If you're traveling internationally, especially to regions where sanitation is limited, be extra cautious with drinking water. Use bottled or properly treated water when recommended. Avoid ice made from untreated water. Wash fruits and vegetables thoroughly, or peel them yourself. Ensure meat, poultry, seafood, and fish are cooked to safe internal temperatures. These practical habits dramatically reduce the risk of many foodborne and waterborne infections. One important point that often gets overlooked is that many digestive symptoms people attribute to parasites actually have entirely different causes. Conditions like lactose intolerance, celiac disease, inflammatory bowel disease, irritable bowel syndrome, small intestinal bacterial overgrowth, gallbladder disorders, or pancreatic conditions can produce symptoms that look surprisingly similar. That's why persistent symptoms should always be evaluated properly instead of assuming parasites are responsible. If your symptoms include ongoing diarrhea lasting more than several days, blood in the stool, unexplained weight loss, severe abdominal pain, fever, dehydration, or symptoms after recent international travel, it's important to seek medical evaluation promptly. Healthcare professionals may recommend stool testing or other diagnostic methods to determine the actual cause and guide appropriate treatment. And if a parasite is identified, prescription medications are often highly effective at eliminating the infection. Natural foods can certainly support overall gut health, but they should complement, not replace, evidence-based medical care when an infection is confirmed. Now let's address one of the biggest misconceptions surrounding intestinal parasites: the idea that everyone should be doing regular parasite cleanses. If you've spent any time on social media, you've probably seen dramatic videos claiming that mysterious strings, clumps, or unusual material in the toilet after taking a cleanse are proof that parasites have left the body. But in many cases, that's not what's happening. Many herbal cleanse products contain large amounts of fiber, gums, or binding agents that absorb water and expand inside the intestines. As they move through your digestive tract, they can form long, rope-like structures that look alarming but are simply the product itself combined with mucus and digested material. Without laboratory testing, it's impossible to identify parasites just by looking at stool. That's why physicians rely on stool microscopy, antigen testing, molecular tests, or other diagnostic methods, not visual inspection. Another myth is that parasites only exist in developing countries. While it's true that the risk is higher in areas with poor sanitation, intestinal parasites can occur anywhere in the world. Foodborne outbreaks, contaminated recreational water, undercooked meat, raw seafood, daycare settings, international travel, and even close household contact can occasionally lead to infection. The key point is that risk depends on exposure, not geography alone. There's also the belief that sugar feeds parasites. The reality is more nuanced. There isn't strong scientific evidence showing that eating sugar directly feeds intestinal parasites in the way many internet posts suggest. However, diets high in added sugars and ultra-processed foods may negatively affect your gut microbiome, contribute to inflammation, and reduce overall dietary quality. So while cutting back on sugary foods is beneficial for many reasons, it's not because you're starving parasites. Instead, you're supporting a healthier metabolic environment and encouraging beneficial gut bacteria to thrive. Another common misconception is that if you don't have diarrhea, you can't have a parasite. In fact, some people have very mild symptoms, or none at all. Others may experience intermittent bloating, abdominal discomfort, fatigue, or nutritional deficiencies depending on the type of organism involved. This variability is exactly why diagnosis should be based on testing and medical evaluation rather than symptom checklists alone. Now let's put everything together into a practical daily routine that supports a healthy gut naturally. Start your morning with a balanced breakfast that includes protein and fiber. For example, Greek yogurt with berries and chia seeds, oatmeal topped with walnuts and flaxseed, or eggs alongside vegetables and whole grain toast. This combination helps stabilize blood sugar, provides nutrients for your immune system, and feeds beneficial gut bacteria. Throughout the day, aim to fill at least half of your plate with colorful vegetables. Different colors contain different phytonutrients, and a more varied plant intake has been associated with greater microbial diversity. Think of your gut bacteria as a diverse community. The more variety you provide, the healthier that community becomes. Include fermented foods a few times each week if they agree with your digestive system. Plain yogurt with live cultures, kefir, kimchi, sauerkraut, or other fermented vegetables can contribute beneficial microorganisms to your diet. Remember, consistency matters far more than perfection. Stay well hydrated throughout the day. Water supports digestion, nutrient absorption, and normal bowel function. Most people don't need expensive detox drinks. Your liver, kidneys, digestive tract, and immune system already perform remarkable detoxification processes every single day. What they need is adequate nutrition, hydration, sleep, and physical activity, not extreme cleanses. Make movement a daily habit. Whether it's walking, cycling, swimming, gardening, or strength training, regular physical activity supports circulation, immune health, and digestive function. Even a 20 to 30-minute walk after meals can help promote healthy digestion and improve blood sugar regulation. Prioritize sleep just as seriously as nutrition. Your body performs much of its repair and immune regulation while you sleep. Aim for 7 to 9 hours of quality sleep most nights, and try to maintain a consistent sleep schedule. Finally, don't underestimate the importance of routine food safety. Wash fresh produce thoroughly. Cook meats to safe temperatures. Avoid drinking untreated water when traveling. Wash your hands before eating and after using the restroom. These simple habits remain some of the most effective ways to reduce the risk of intestinal infections. As we wrap up, here's the most important message to remember. Your body is not defenseless. Your stomach acid, digestive enzymes, beneficial gut bacteria, intestinal lining, and immune system work together every single day to protect you from harmful organisms. Rather than chasing miracle detoxes or expensive parasite cleanses, focus on strengthening these natural defense systems through nutritious foods, regular exercise, adequate sleep, stress management, proper hydration, and good hygiene. And if you experience persistent digestive symptoms, especially prolonged diarrhea, unexplained weight loss, blood in the stool, severe abdominal pain, or symptoms following international travel, don't rely on guesswork. Seek medical evaluation. Proper testing can identify whether a parasite is present or whether another digestive condition is responsible for your symptoms. Once the cause is known, the right treatment can begin, giving you the best chance of a full recovery. Before we finish, I'd like to leave you with one final thought. When it comes to gut health, there are no shortcuts. Your digestive system is one of the most complex ecosystems in your body, and it thrives on consistency, not quick fixes. While it's tempting to believe that a single cleanse, supplement, or trending remedy can solve every digestive problem, the science tells a different story. Your body already has an incredible built-in defense system. Every day, your stomach acid helps destroy harmful organisms. Your digestive enzymes break down food efficiently. Your beneficial gut bacteria compete with unwanted microbes, and your immune system continuously patrols your intestines, protecting you from potential threats. When you nourish these natural defenses with wholesome foods, regular movement, quality sleep, proper hydration, and good hygiene, you're giving your body the best opportunity to stay healthy. If you suspect you have an intestinal parasite because of persistent diarrhea, unexplained weight loss, severe abdominal pain, blood in your stool, or symptoms after traveling, don't rely on internet advice or self-diagnosis. The safest and most effective approach is to see a healthcare professional who can perform the appropriate tests and recommend evidence-based treatment if needed. In many cases, prescription medications are highly effective, and delaying proper care can allow the infection to persist longer than necessary. For everyone else, remember that many common digestive complaints are far more likely to be related to diet, stress, sleep, food intolerances, or imbalances in the gut microbiome than to parasites. That's why focusing on the fundamentals of good health often produces the greatest long-term improvements. So here's my challenge for you. Over the next week, choose one new gut-friendly habit and stick with it every day. Maybe it's eating an extra serving of vegetables, drinking more water, taking a daily walk after dinner, getting to bed 30 minutes earlier, or adding a fermented food to your meals. Small changes, repeated consistently, can create remarkable improvements over time. Your gut works hard for you every single day. It helps digest your food, absorbs essential nutrients, supports your immune system, and even communicates with your brain. Taking care of it is one of the best investments you can make for your overall health and longevity. If you found today's video helpful, please give it a thumbs up, subscribe to the channel, and turn on notifications so you never miss our latest evidence-based health videos. And I'd love to hear from you in the comments below. What is one daily habit you've started that has made the biggest difference in your digestive health? Your experience might inspire someone else to begin their own journey toward a healthier gut. Thank you so much for watching. Stay healthy, stay curious, keep making informed choices backed by science, and I'll see you in the next video.